the younger patient population is so vital when you're talking about, I guess, hopes and aspirations for viral eradication, right? Assuring that, just because we've assured that this population is in a much better spot doesn't mean the next generation is going to fit exactly into that mold. And, you talk about the younger patient group, they're less likely to be insured. They're less likely to seek out medical care in that sort of fashion. So understanding, what the options need to mean for which patient is absolutely, critical for this sort of procedure, preventive measure.
Yeah, the young piece I think is really really important and really difficult. And I think we talk about it all the time. We wish there was one thing that could be done that's going to really increase the awareness and utilization among young people. We've had a few things. Some of them are in the poster, some are not really in the poster. We've lowered the age where you can enroll in the PrEP assistance program down to 12 to match up with the FDA indication for PrEP. So now minors are able to enroll in the PrEP assistance program. And we also have incorporated what we're calling a minor and confidentiality clause so that people can enroll in the program as a minor or as somebody who is a partner of another person who has health insurance. And they can enroll in the program without utilizing either their parents' health insurance or their partner's health insurance if there's a confidentiality concern. So if there's a concern that if the billing for the PrEP, because a lot of young people are still under their parents' insurance until they reach 26, and that's exactly the age group that we're seeing a lower enrollment in our PrEP assistance program. So if there's concerns that if the payment's kind of showing up on your parents or your partner's insurance program is going to result in stigma or is going to result in a barrier to people wanting to access the program, you can access the program without having the billing go to that insurance, and it will go to the PrEP assistance program. So we're hoping that that's going to be, reduce a barrier in one way to young people. The other is that we've started to work with our California State University medical clinics. And so we've piloted a PrEP enrollment program that we're hoping to roll out at Humboldt State University. And so that's sort of in the northern part of California where there are some options for PrEP, but not necessarily a lot of options for PrEP. Students will come from different parts of California, and actually they have difficulty because their insurance might not have a provider in that part of California. So they have insurance, even if they wanted to, have trouble utilizing their insurance because they're suddenly out of network when they're at that university. So I think there's unfortunately there's no one way. I think we're gonna boost enrollment in that really critical group of people. But I think if we can really just keep looking at from a system standpoint, what are all the reasons why people are having trouble enrolling in the program, taking advantage of this benefit? Hopefully that's going to help. You also mentioned kind of that we are really blessed in California that there's so many great organizations and groups to work with, and so we also kind of feel we want to get out of the way of those groups too. So we want to provide the service and then let them provide the service in the way that makes the most sense. Because groups that are already working with youth, they already have these established relationships. They're telling us what the barriers are as best we can. We can try to reduce those barriers and then get out of the way and let them utilize their knowledge, their skills in working with younger people, working with Black, African American, California's all the different groups that we're really seeing under enrollment in. The one group I think we still feel like we need to do better in, but we have seen pretty good enrollment in has been the Latinx population in California. So that's numerically, that's the biggest group enrolled within our PrEP assistance program. So that's something we're definitely proud of. And it really is a situation that we've got all these great groups working, particularly in Los Angeles County and throughout Southern California that have really excellent relationships and have just done so much with education that they have been able to enroll a lot of Latinx population in the PrEP assistance program.